Good morning, everyone. Thank you, Dr. Volkov. As always, amazing. And I don't know, for the past several years, being able to hear you speak, there are very few times in Washington, D.C. That when you hear someone speak over and over again, you learn something every time. But I have to say that with Nora, that's every time I learn something with you. Not to disparage colleagues in Washington, D.C. Again, welcome. Good morning, everyone. Thank you all again for being here. Thank you all to the distinguished speakers today. Everyone's presence here in the room or online is a testament to this administration's commitment to end this epidemic, and we're honored that you could be here. My name is David Mineta. I'm the Deputy Director for Demand Reduction here at the White House Office of National Drug Control Policy. And as Dr. Volkov noted, science clearly shows that substance use disorders are a disease of the brain that can be successfully prevented, treated, and recovered from. This knowledge is what drives our work each day, and is why this administration has placed such an emphasis on public health approaches to reducing drug use in America. But we can't do this alone. Preventing opioid abuse depends on the hard work and collaboration of everyone: parents, teachers, healthcare professionals, law enforcement, and state, local, and federal officials. We all have a role to play. In particular, as Governor Shumlin illustrated, states are leading the way on developing innovative solutions to reduce drug use, to treat substance use disorders, and to support millions of people in recovery. I'm honored today to introduce a wonderful colleague, Rob Morrison, Executive Director of the National Association of State Alcohol and Drug Abuse Directors, who will present NASDAD's recently released report, State Substance Abuse Agencies, Prescription Drug and Heroin Abuse, Results from a NASDAD Membership Inquiry. State alcohol and drug abuse directors are very much on the front lines of responding to the opioid crisis in the states. And I want to thank NASDAD for providing a timely overview of the impact states are seeing, not only in terms of emergency visits and burdens on the treatment system, but also challenges that they are facing and strategies the states are employing to address this important issue. So with that, I'd like you to welcome a great colleague and a good friend, Rob Morrison.
Thank you, Dave. Thanks very much for your leadership. And I want to thank you in particular for making sure that as we talk about these issues, we know that prevention is a critical component, and your work on substance abuse prevention has been exemplary. It's been a pleasure. Acting Director Botticelli, thank you for your leadership. And I appreciate you getting together so many folks who represent so many sectors, law enforcement, right on down the line. I did get a chance to go to the State House in Vermont on Monday, and it was an incredible, inspirational event where I think there are going to be results. And that's what I look forward to this meeting, leading to results. We are pleased to talk about an inquiry we did of our members, and I want to recognize the authors here today. Rick Harwood, he is Deputy Executive Director. I also want to recognize Colleen Holler. She's a policy associate. They asked states to talk about what they were doing on prescription drug abuse in 2012, and then we added questions about heroin. We had a robust response of 46 states, and here's what we found. For prescription drug abuse, states indeed say this is a top priority. And as mentioned by Dr. Volkov, they saw an increase of 500% in admissions to treatment for prescription drug abuse since 2001. Much activity, though, is moving forward, including convening task forces, enacting legislation, regulatory actions, and in addition, education that we'll talk about in a moment. For heroin, indeed, states cite that as a vital issue as well. A majority of states have seen increases in admissions to treatment for heroin, something that confirms the anecdotal reports we've all been hearing. We've done it directly with our state agencies. In turn, they're focusing on increasing access to medication-assisted treatment, expanding access to naloxone, as was mentioned earlier, and also providing education to the public. So taking a deeper dive on prescription drug abuse, what you see is a comparison of the data that we found in 2012 with 2014 in particular. So we see more states convening task forces to the tune of now 34 states have a task force specifically focused on prescription drugs. This is in addition to all states having a state plan for prevention and treatment and recovery. That is the job of the state agency who oversees each state system. Education. We saw an increase for states educating the general public to a point where now 43 states are working, working to educate the general public in particular. Taking a deeper dive on specific targeted educational activities, you see specific increases in education of prescribers, physicians. You see an increase for education on pharmacists, and then also patients and families. So this is going in the right direction. We talk about the importance of prescription drug monitoring programs. We agree 100%. In fact, state substance abuse agencies very much value the data that they generate. This is an important set of data that our members don't necessarily collect directly. What we also found is a need for additional collaboration, as state agencies don't necessarily lead those efforts and have regular dialogues about how to use that data to benefit the publicly funded prevention, treatment, recovery system. I think that's an area ripe for action. Colorado we highlight for you in particular. We highlight this because of the governor's pledge with a focused outcome goal of reducing the prevalence of prescription drug abuse in his state. We also highlight that because the core components of the consortium to reduce prescription drug abuse mirror many of the components in ONDCP's prescription drug abuse plan. And that's another message. Federal leadership matters, and the coordination between state and federal folks is vital as we attack this problem. So, training, technical assistance needs. We agree with Dr. Volkoff. Taking the evidence that we know in research and applying that is critical. We also know while we're doing a lot on education, we need more, especially of the general public, to attack the discrimination that the governor mentioned earlier. Remaining challenges. No surprise, a challenge with funding. In particular, as I talk to state directors, indeed, funding and ensuring access to medication-assisted treatment is indeed a challenge, but one that we're attacking head-on. We also know workforce issues are there, the prescription drug monitoring program that we just talked about, but also the lack of public education and involvement. Heroin. What we think we did was we took, again, the anecdotal discussion about heroin and turned it into hard data that state substance abuse agencies are seeing. So in particular, 37 states reported increases in admissions for heroin treatment over the last 2 years. This is an astonishing number that in turn confirms the anecdotal that we talked about. In addition, 27 states reported increases for fatal overdoses to heroin. That's over the past 2 years. And what we were able to do was highlight using a map both increases in admissions for heroin, increases in overdoses, and increases in both. So red, yellow, purple mean a lot of activity on heroin in particular, and indeed a call for action. So what are state substance abuse agencies doing? Heroin in particular, they too are engaging in education in particular, in printed materials, but they're also addressing the question that we've talked about, and that is, what are we doing to address the transition from prescription drug to heroin? Are we educating the public specifically on that issue? And you can see a number of states are doing just that. Medication-assisted treatment. This is a top priority of our board of directors. Our chair, Mark Stringer from Missouri, made sure that the association did a great deal of work. We actually issued our only one-page statement, a consensus statement on medication-assisted treatment. It's our only clinical statement that we've ever issued beyond public policy. That's how important it is. What we see is expansion of medication-assisted treatment using a number of mechanisms, Medicaid through the State Substance Abuse Agency Office, that's what SSA stands for, but we also know all states have opioid treatment programs as well. We need more, though, and we need to take the evidence that Dr. Volkoff talked about and apply it. Overdose prevention. We saw in 2012, 12 state substance abuse agencies indicating that they were making plans or they were taking active steps to make naloxone more accessible. We saw that increase in 2014 to 21 states. Again, we need more, and this is only the State Substance Abuse Agency action on naloxone. An example, Gary Tennis, board member, he's State Substance Abuse Director in Pennsylvania. He put together an overdose rapid response task force that combines a number of different agencies, cross-sector in the government. One priority is bettering our communication, maybe the ADT approach that Dr. Volkoff discussed, but also our goal is to get folks into treatment after these overdoses so we can help them enter into recovery. States considering who can administer naloxone, as you can see, 29 states are considering in various ways who can actually administer. Here's an example of additional actions. New York, Arlene Gonzalez Sanchez is the commissioner, State Substance Abuse Agency Director. As you can see, more than 6,000 individuals have been trained as responders. And as a result, 223 opioid overdose deaths have been reversed since the fall of 2013. This complements those efforts in Vermont, Massachusetts, and the like. We see special initiatives on heroin in particular, and they come in different categories: naloxone, education, increasing access to medication-assisted treatment, but also work in the criminal justice system, as Governor Shumlin just discussed. We also know 15 states, in addition, have specific interagency task forces focused on heroin as well. A number of others are adding heroin into their task force work on prescription drug abuse that we talked about some time ago. Ohio. I highlight Ohio in particular because, of course, neonatal abstinence syndrome is a priority. The administration talks about it. ONDCP should be lauded for their work in this area. For Ohio, they are engaging in the Maternal Opioid Medical Supports Project to ensure that pregnant women get the treatment they need and deserve, including medication-assisted treatment. What we see in Ohio, too, is an increase in overdose deaths. Heroin, it doubled in 2012 from 2008. Challenges we talk about, indeed, resources, funds. Treatment capacity is indeed still an issue. And again, the discrimination that we all know exists and getting people to understand addiction as a disease. So recommendations, our favorite part. We recommend and encourage a strong connection with federal policy in the states, in particular state substance abuse agencies, who already have a system for prevention, treatment, recovery. Leveraging this system, leveraging these many activities that they're already engaging in, will help us ensure that we're not doubling up in areas where we know certain activities are going on already. The PDMP and State Substance Abuse Agency connection, we think, is ripe. We think would provide an excellent opportunity to engage the data that we know exists to benefit public health. Connecting with state substance abuse agencies and grants and the like will help us also with the data that we know is so effective in ensuring that the federal government can show the general public that what we're funding is effective. that the outcomes associated with treatment, prevention, and recovery are worth the investment. Speaking of investments, the Substance Abuse Prevention Treatment Block Grant is the backbone of our system, and we recommend a strong investment. In particular, 20% of the Substance Abuse Prevention Treatment Block Grant is required for prevention, and boy, do we need it. Our investment in prevention has been dwindling, and primary prevention is critical. And again, I want to laud Dave for his leadership on that, and we need those resources badly. Medication-assisted treatment, as I mentioned earlier, will be a continued focus. We'll be promoting and discussing the overdose in particular with our board, but just know state agencies aren't waiting for a piece of paper to move. We've already seen the specific actions on overdose. We need strong federal agencies dedicated to addiction. We need a strong SAMHSA, a strong ONDCP, NIDA, and IAAA. We need them. So I want to just conclude by saying September is Recovery Month. And wouldn't it be neat to not only celebrate across the country in capitals the story of recovery that we know is so important, but wouldn't it be neat to celebrate a set of federal actions we could all rally around, specific actions that we know work that we'll be discussing today, and a final package that will help families across the country. So thank you, and I appreciate us.